Hi viewers, welcome to our YouTube channel MBBS Guide. Must subscribe our channel and like this video for new upcoming topics. Today our topic is anterior abdominal wall. Overview. Abdominal wall is for support of the abdominal contents. By flexible abdominal wall, physician can feel many abdominal organs and can diagnose a proper disease. It gives sometime attachment to muscles also. Layers. There are 7 layers of anterior abdominal wall. 1. Skin, 2nd. Superficial fascia, 3rd. Deep fascia, 4th. Muscles, 5th. Transverse fascia, 6th. Extraperitoneal fascia, and 7th. Parietal peritoneum. Now I am going to discuss the layers in deep. So first one is skin, loosely attached to underlying surface except umbilicus where it is tethered to the scar tissue. The umbilicus is a scar representing the site of attachment for the umbilical cord. In the fetus, it is situated in linea alba. Nerves. Cutaneous nerve supply to anterolateral abdominal wall is derived from anterior rami of lower 6 thoracic nerves, which are T7, T8, T9, T10, T11 and T12, and the first lumbar nerves L1. Arteries. Arteries are divided according to the area. Branches of superior and inferior epigastric arteries supplies the midline region. Branches of the intercostal, lumbar and deep circumflex iliac arteries supplies the flank region. And superficial epigastric, the superficial circumflex iliac and the superficial external pudendal arteries, branches of the femoral artery supplies the inguinal region. Veins. Venous drainage is also divided according to the area. Upper abdominal wall passes mainly into axillary vein via lateral thoracic vein, and lower abdominal wall drains into the femoral vein via the superficial epigastric and the great saphenous vein. Now muscles. I have attached the chart of the muscles, so we will read from it. Muscles of the anterior abdominal wall. First muscle is external oblique. External oblique origin is from lower atrius and insertion is to xiphoid process, linea alba, pubic crest, pubic tubercle or iliac crest. Its nerve supply is lower 6 thoracic nerves and iliohypogastric and ilioinguinal nerves L1. Its action is to support abdominal contents, compress abdominal contents, assist in flexing and rotation of trunk, assist in force expiration, micturition, defection, parturition and vomiting. Second muscle is internal oblique, whose origin is from lumbar fascia or iliac crest or lateral 2/3 of inguinal ligament. Its insertion is to lower 3 ribs and costal cartilages, xiphoid process, linea alba and symphysis pubis. Its nerve supply is lower 6 thoracic nerves and iliohypogastric and ilioinguinal nerves L1. Its action is same as external oblique. Now third muscle is transverse abdominis. Its origin is from lower 6 costal cartilages, lumbar fascia, iliac crest, lateral third of inguinal ligament. Its insertion is to xiphoid process, linea alba and symphysis pubis. Its nerve supply is lower 6 thoracic nerves and iliohypogastric and ilioinguinal nerves L1. Its action is compress abdominal contents. Fourth muscle is rectus abdominis. It originates from symphysis pubis and pubic crest. Its insert into the 5th, 6th and 7th costal cartilages and xiphoid process. Its nerve supply is lower 6 thoracic nerves. Its action is compress abdominal contents and flexes vertebral column, accessory muscles of expiration. Fifth muscle is pyramidalis. It's optional. Sometimes it's present or it's not present. It originates from anterior surface of pubis. It's insert into the linea alba. Its nerve supply is 12 thoracic nerves. Its action is to tense the linea alba. It was all about the muscles of the abdominal wall. I have attached the chart to make you easy. Diagram of muscles of the abdominal wall. You can see this, your concept will be more clear. And now fifth layer, transverse fascia. The transverse fascia is a component of an extensive thin layer of fascia that lies between the muscle layer of the abdominal wall and the parietal peritoneum. It is continued below with a similar fascial lining the pelvic walls. Sixth layer is extraperitoneal fascia, a thin layer of connective tissue that contains a variable amount of fat. It lies between the transverse fascia and the parietal peritoneum. Seventh layer is parietal peritoneum. Deep sides of the wall of the abdomen are lined with parietal peritoneum. This is a thin serous membrane and is continuous with below with the parietal peritoneum lining the pelvis. It was all about the anterior abdominal wall. Thank you for watching our video. Must subscribe our channel and like this video for new upcoming topics.